I understand that the Tobacco Control Office already makes available at least one such product. The Tobacco Control Office here in Hong Kong already makes at least one sort of e-cigarette, type of e-cigarette available as a smoking cessation device. What's wrong with the current regulation? Why should they make it available over the counter insurance?
Well, first of all, it's down to consumer choice. But there's a wider debate here, which I don't really want to go into that much. But essentially, efforts to regulate nicotine products as medicines, which is, I think, what you're talking about. Yeah. This is a smokescreen. Nicotine is not a medication. It doesn't treat anything. It doesn't cure anything. You can't dose it. And under the World Health Organization's own classification system for a medicine, nicotine just simply does not fit into it. It isn't. So if you're going to demand that it be registered as a medicine, no nicotine product is no nicotine e-cigarette anyway has ever been or ever will be classified as a medicine. It isn't a medicine. And one other thing I want to say, you use that word smoking cessation, and yes, it's a valid arm of medicine, perhaps, because smoking is a disease, is regarded as, it certainly causes disease. However, when you look at the figures for pharmaceutical smoking smoking cessation products, within 6 months, 64% of smokers who complete a smoking cessation course revert to smoking again. Over a longer period of time, it comes up to about 96%. So this is a very ineffective way, and it takes away the right for consumers to choose to continue to consume nicotine, but in a safer format. If you want to quit smoking, the only way, and I know this myself personally, and so does John, the only way you can quit smoking is to put it in your head that you're going to quit, and through an act of will, quit. If you continue to take nicotine into your system by whatever means, then that's not really quitting. Quitting means stopping. So the whole pharmaceutical intervention thing is very controversial. And as far as classifying any e-cigarette as a medicine, forget it. It's not going to happen. It isn't a medicine.
I come back to the statement I mentioned just now, which is public health experts are telling us there is no public health demand for an end to nicotine. We met at a global conference on nicotine in Europe last month with a whole string of what can only be called stars of the harm reduction industry. These are anti-smoking experts, they are tobacco control experts, they are experts in their field, top scientists and medical people. And this is what we heard time and time again. There is no public health demand for an end to nicotine. Nicotine is not the problem, smoking is the problem.
If I could just clarify in really simple terms, what that means is that nicotine is not the problem. Tobacco, burning tobacco, is the problem. They're two separate things.
I have two questions. The first one is that how would you explain why the e-cigarettes, the smokers think e-cigarettes is a positive alternative to the conventional cigarettes? How would you guys explain why? And then the second question is, again, what is the proof of e-cigarettes? It's 90% better than the conventional cigarettes. What is the proof of that? Can you tell me the source? Thank you.
The source of the quote that said they're at least 95% safer, you will find in one of the pages of your fact sheet when you get it at the end of this conference.
They've already got it.
Oh, they've already got it. The last particular quote is from Professor Peter Hayek, who's London-based. He's director of the Tobacco Dependence Research Unit at one of London's top hospitals, and he's also director of the London School of Medicine. Speaking just 6 weeks ago, he said, my reading of the evidence is that e-cigarettes are at least 95% safer than smoking. Smokers should be encouraged to switch to vaping. We're passing this information on, we're not making it up.
Is it mainly because there is no tar? No tar?
Yes, it's because there's no tar, there's no smoke, there's no particulates, nothing is burned. When you burn stuff, you create all kinds of other compounds. When you vaporize it at the kind of temperatures that an e-cigarette uses, there's absolutely nothing that anybody's found in a properly constructed e-cigarette that's used as intended that would come anywhere close to being a carcinogen or even remotely likely to harm. No one has ever died from smoking an e-cigarette.
And how would you explain why the smokers think e-cigarettes is a positive alternative to conventional cigarettes?
It's a good question. It's a positive alternative because it offers a method to either quit smoking or quit nicotine altogether. That's their choice, which is, as we now demonstrated, 95% safer. It doesn't carry any appreciable risk in comparison to smoking. So if you like your nicotine and you want to continue getting nicotine, we say you should have available to you the choice to switch to something which has less risk. Okay?
Can I just jump in there, because I think your question is more about, from a smoker's perspective, why would he do that? The e-cigarette was invented by a Chinese scientist called Dr. Hon Lik, and he was a smoker, and he saw the disease it was causing in his own family and around him, and he thought, well, this is dreadful. What can I do about this? So he created this device to deliver the nicotine without the burning, and he designed it in mind to think, I have to try to mirror as far as I can the experience that a smoker gets when he's smoking, because that's what they're used to, and it's going to be difficult to persuade a smoker to switch to a device that doesn't closely mirror the experience and the ritual and the effect that smoking does. And largely he seems to have succeeded. Now, I do not smoke e-cigarettes. I've tried it a couple of times, and you know, I don't sell them, I don't trade them, I'm not recommending them, but they were designed to mimic, mirror and replace conventional cigarettes. So consequently, a lot of work has gone into trying to make it feel and taste and have the same effect as cigarettes. And according to many vapors we've spoken to here in Hong Kong and elsewhere, yes, it does. For some it doesn't work. But again, it's down to choice. If people want to have the option to try it, well, they should have that option. That product should be available. Some will stick with it, some won't. But they should at least have that choice. And, you know, it comes down to, I once heard a New Zealand, I think it was the New Zealand health minister who was responding to the erosion, to claims that the rights of smokers were being eroded. And she said, if we can save just one life, then it's all been worthwhile. E-cigarettes have the potential to save millions of lives. So why would we not be allowing them?
But even WHO cannot confirm that e-cigarette is a good way to quit smoking. And that's a report done by WHO last year. Even cannot confirm. So why can you guys confirm that it's a good way?
Let me clarify one thing for you. We are not doing the confirming. We are passing on the confirmations of the real experts, the real scientists in the field. Some of these advocates for harm reduction have been very closely aligned with the World Health Organization in the past. The World Health Organization just hasn't apparently caught up with the progress being made. I'm still impressed by the fact that the tobacco control experts and the anti-smoking experts are the ones saying that not that WHO is wrong, but the WHO's policy is restrictive. WHO appears to be saying quit or die. Okay? We think that there should be something else between that. Quit is very difficult, and as we said before, not everybody wants to quit. What they're saying is if you continue smoking cigarettes, you will run a very high risk of death or disease. We don't disagree with that, but we think there should be an intermediate step, and this is what the tobacco control experts are now saying. There should be this intermediate step of e-cigarettes, which are shown now to be at least 95% safer than cigarettes. WHO simply hasn't got that middle step yet.
I think it's important to note that many of these harm reduction advocates were formerly, or in some cases are still, connected to the WHO. So, you know, science is science, opinion is opinion. Science doesn't move that quickly, but it's quite clear that more and more scientists who have previously been unsure or even negative have said, no, it's wrong, e-cigarettes are the way forward. I've spoken to dozens of these people. I mean, they're from the WHO and what have you. But the WHO is a very conservative body, and fair enough. But the decisions the WHO has made on trying to reduce smoking, which include raising taxes and so on and so forth, have actually not had the impact they hope it would. And many of the people, in fact, I would say the key people who develop these strategies for and with the WHO are now saying, okay, we didn't exactly get it right, but we have this opportunity here to actually really make a difference here on global smoking incidence. We can actually really expect to see a huge decline in the number of smokers if we start encouraging them to switch. And that can be done at the level of persuading doctors, okay, you've been told this, you've been told that, but actually here is the evidence, so now we're recommending that when you have a smoker present to you, you should say, hey, you should consider trying to switch to e-cigarettes. This is going to help you. That's what we're hearing. So they will come round to it once the vested interests have been silenced.
Many of you, I'm sure, will have heard of the UK-based organisation Action on Smoking and Health. It doesn't come any more anti-smoking than ASH, Action on Smoking and Health. Even the guy who started ASH and was director of their policy and research, another scientist who's now involved in government public health in the UK, even he is an advocate for e-cigarettes.
You do understand where the skepticism is coming from then, because the tobacco industry for many decades was very effective in promoting cigarettes as a safe product. So people are afraid that e-cigarettes will be sort of a Trojan horse for more nicotine addiction and down the roads also a dangerous product.
We're sceptical too of everything. In case.
Yeah. I mean, we're not taking this at face value in any sense. But I will say this: that it's absolutely true that tobacco companies were dreadful. They were distorting the evidence. They were creating scientific surveys or experiments that would tend to prove their side of it, and were misleading consumers. Unfortunately, that exact same tactic is being adopted by some anti-smoking groups and activists who are distorting the evidence, who are actually withholding and restricting access to research that would disprove their preferred position, and they're coming out with rhetoric and so on and so forth, which is being fed to the media and isn't really being countered by facts. So we're here to counter that by offering facts as opposed to opinion and rhetoric. So the facts that we're offering is from scientists who are probably much cleverer than me, maybe, who are doing the work, understand what they're doing, and seriously believe that e-cigarettes is absolutely a potential salvation and the single most effective treatment we have for addressing the death and disease that smoking causes.
I have some questions. The newspapers and government said that e-cigarettes does more harm than the traditional or the real cigarettes because of the impurities or the solvents in the e-cigarettes. But you claim that e-cigarettes are much safer. So which one is correct, or how do we address this problem?
Another good question. This goes back to the quality and safety issues that we've already raised. Just making any old product from across the border available anywhere in the world is not the way forward. The way forward is to introduce, as H has already said, international style safety and quality standards, and that's what we're advocating to the Legislative Council. Unregulated, homemade ingredients we do not recommend, and neither do the health, the harm reduction experts.
I mean, look, there's been a lot of reports which focus on dreadful things that are found in e-cigarettes, but again, if these products were regulated, if you didn't allow the importation of a product that didn't meet specifications, manufacturing and contents and ingredient specifications, if you don't get that in place, then yes, you're going to be potentially subjecting your consumers to products that are not safely manufactured. But an e-cigarette that's manufactured correctly is not an issue. It doesn't have this kind of stuff in. If it's used the way it's intended to, and the products and ingredients that are in it are the right ones, there isn't.
Another question, how about the cigarette without nicotine? Say, for example, if the electronic gadgets there is packaged like a cigarette, and then when you suck it, it will produce vapor, but the solvent does not have the nicotine. How? You
mean a nicotine-free e-cigarette, yes? That's what you mean? Yes, yes.
Okay, so what's the attitude? Because the government want to ban all the nicotine-free cigarettes,
yes.
And for the cigarette with the nicotine, they regard it as a medical prescription. So that's my understanding. So they try to ban all the nicotine-free e-cigarettes for the public safety consideration.
Again, I would suggest that this is an issue of fairly simple regulation of a consumer product. You would not expect to go into a shop and buy food or drink products, for example, that are not subject to quite reasonable safety standards. We would advocate something similar for nicotine-based or nicotine-free e-cigarettes. What we're saying is, if they are properly made, then all the evidence that we've presented is in favour of their availability. It will be doing consumers in Hong Kong a very good service to make sure they are manufactured and distributed to appropriate standards.
If I can add there, it comes down to choice. If somebody chooses to use that product, then they deserve to have the understanding that it's safe, that it's been manufactured safely. With regards to the non-nicotine flavoured variety, we met a fellow on the street and he was vaping, and we got to talking to him, and this is what he said. He said, I've been vaping these nicotine-free products now for 2 or 3 years, and my consumption of cigarettes has gone right down. When I want nicotine, I had to go back to a cigarette, but when I just want to fiddle with my fingers or just, enjoy the sensation of vaping, then this restricts it. And he said, I go days without smoking a cigarette. And this is the product that's helped me to do that. There's no nicotine in it. It's half the story for him. He would much rather that nicotine was available because then he could just stop smoking. But that's not available to him right now. But now, in his particular case, the government's proposal will stop him from using a product that is got no nicotine in it, but which actually substitutes for cigarettes much of the time. So his consumption is right down. If the government bans it, he's no choice. He's got to start smoking again.